If you're on a Medicare supplement, you're probably feeling the pain of price increases recently. In fact, this coming June 2026 or in the spring, you probably got a letter in the mail saying, hey, guess what? Your Medicare supplement insurance plan price is going up big. And you're not alone because this is happening across the country. In Florida, we've seen some crazy price increases, 15% recently for some. Across the country, people are experiencing this pain. And it's something that we want to talk about today because it hurts. And I want to talk specifically about what steps you could take right now to fix it, to do something about it, why it's happening, and what you and what your options are. So let me bring in my co-host, Tony. Welcome to the show. We're talking about the pain of Medicare supplement pricing. It's happening. It's getting out of control like I've never seen before, and I've been doing this for quite a while. Have you heard about this?
Have I heard about it? I've been knee deep in the hoopla, as Jefferson Starship said. I tell you what, with my parents, I've been dealing with this. It's not a good situation. I mean, all you have to do is say the words health insurance, let alone a Medigap or, Advantage, Medicare Advantage, supplemental. The healthcare industry, as we know, is problematic, and it's exponentially increased in price for people, especially insurance. And I'm telling you right now, a lot of states are dealing with the insurance companies that used to provide really good Advantage plans, and a lot of seniors are on Advantage plans with their Medicare Advantage. They're just saying, yeah, no, we're not making enough money off. We're just going to stop with very little notice. Then you have to go to one of the remaining in Minnesota, where my parents live. Of course, they both are in long-term care, both on Medicare. One's on Medicaid as well. But they both had Medicare supplemental insurance through a company that Advantage plan. I'm sorry, Advantage plan. It was great, but they just canceled it out of the blue and left them in the lurch. And I looked into it. You have one option. How is that? There's only one company now in their region, in their zip code, and it's by zip code. It's not even by state. It's by zip code. It changes what you can get, changes by zip code, even in Florida, right?
Yeah,
and it's problematic because it's gone up exponentially in price, especially the supplemental insurance, or as you call it, Medigap.
Yeah. Mm-hmm. And what's interesting is people join a Medicare supplement because they don't want to be bothered with the Medicare Advantage drama that you're describing. So they say, oh, I'm going to go on supplement. I'll be safe.
Yeah.
But then guess what happens?
And now, today's shocking information.
They get shocked. Like you and I literally did in that video. That wasn't fake. You and I actually got an electrical shock. Why we tortured ourselves for that video? Not my idea, but let's move on.
You know, a lot of people get Plan G. Plan F was the biggie, and then they stopped allowing that. People are still grandfathered in, but Plan G became the new Cadillac of Medicare, Medigap, Medicare supplements. And across the board, rates 12 to 26 and higher increases year.
12% to 26% increase.
The Medigap increase.
Yeah, the Medigap. I looked at Medigap for my parents, and it went up 20% here.
Yeah, from just the previous year.
Yes.
When I started this years ago, 15, 20 years ago, the price increases were 0, 3, maybe you'd see a 5% increase one year and you'd be like, oh, you'd clutch your pearls. Now I'd be happy with a 3 or 5% increase.
5% would be beautiful, actually, right now.
It's really surprising and shocking people, and especially people that are on the Plan G that are used to, all right, I know I'm paying for this, but it's starting to get a little out of hand. Because if you have 2 years in a row of 20+% increases, all of a sudden you're saying, what? How did this price double so quickly?
Yeah.
You know, it's getting crazy. So why? It boils down to utilization. More people are using the doctor, people getting older,
Yep.
medical inflation. You've talked about that. More claims. So what does Medicare do? Medicare itself, the deductibles and copays are going up. So the gap widens that Medigap is covering. So they pass it along. They pass that along. And I'm bringing this up now. We're getting close to June. My clients who are on Medigap received, well, not all of them, but a lot of them did, because some companies increase rates every calendar year. Some companies increase it in June. So they're getting that notice in May and saying, hey, your price is going up 15%. And what are they going to do? That's the problem. What are they going to do? That's what I want to talk about.
Excellent.
So we know Social Security has a COLA increase, right? 2.8, it's on average. So for the average person, that's $56 a month. Medigap increases by 15% one year and then 15% another year. There goes that extra money you were getting in Social Security.
Mm-hmm.
It's eaten up right away by the Medigap price increase. It's like, what's going on?
So you're not actually seeing more money to spend on things in your life. It's just going for health insurance and Medicare. Yeah.
Right. So what do? Do you just take it on the chin? No. There is something you can do. There is some good news about it. And this is one of the many reasons why people get Medigap plans and Medicare supplements to begin with, is because they can shop. So you know how Medicare Advantage has their annual enrollment period, October 15th through December 7th, right? Medigap doesn't have that. You could shop for plans year round. And a Plan G from company XYZ is the same as a Plan G from company ABC. They're the same benefits. By law, federal government regulates this. So the only real difference, Tony, between these plans is the price and the company and their stability and their rate increases. But in theory, you could switch whenever you want. There's no window.
Yeah.
So when people are getting their notices in June saying, hey, your price has gone up 20% again, they don't have to say, oh, I got to wait till October to shop, or, oh, I'm stuck. What am I going to do? You can actually switch.
I wasn't aware of that. And that's with a Medigap or a supplemental insurance plan. You can switch those. I don't think it's the same way with an Advantage plan, though. And I know we're not talking about Advantage plans. I keep bringing it up, but because it's been a thorn in my side. That's why.
It's different. It's different than Medicare Advantage. Medicare Advantage has an annual enrollment period. There are some situations where you can switch a Medicare Advantage mid-year.
Yep.
If the plan drops like your parents did.
Yeah, they extended it. Yeah, they extended it. Yeah. Yeah, it's still you still had to, they extended how long you had to find a new one. But it was only rather than December 7th, it was like January. I mean, they give you an extra month. So or so, month and a half. I want to go back really quick, Dan, because this is a question I had, or some people might not realize. I just want to point out, when you talk about those Medigap increases, and then you mentioned the Social Security cost of living adjustment is only 2.8 or 3%. Typically, this year it was 2.8%, and that gets eaten up by the increases in your Medigap policy. It also gets eaten up by increases in the Medicare Part B premium, and some people don't realize you must continue to pay your monthly Medicare Part B premium even if you have Medigap or a Medicare Supplement plan.
Yeah, you still have Part A and B.
So that goes up. That alone eats up some of that cost of living COLA adjustment you get. And if you have a supplemental, the increase in that will probably take care of it. Yeah.
That's right. And so that's why it's important to shop.
Yeah.
A lot of people get them and they set it and forget it. They don't think about it anymore until they get these price increases, which haven't been around the price increases are relatively new. There's always been price increases, don't get me wrong. But the double-digit price increases, I was reading somewhere, I think it was Illinois, there was one company that increased price 47% in 1 year. Oh, like what? Right?
Yeah,
So
see, that should be, I mean, and I know that you and I don't always see eye to eye in government regulations, but you'd think the government would be able to regulate how much they're allowed to increase. I know you're laughing.
oh geez, Tony. Did you just say I'm from the government? I'm here to help. Those
I
are
did not. I did not. But
very
certain regulations.
dangerous, scary
Otherwise, I
words.
mean, private companies are all about profit margins, and they go crazy. At some point, I mean, that's crazy. I think credit card companies should be limited on what they can charge in interest. I think it's loan sharking at 30%.
Stay on task, Tony.
I know.
Don't
I
go
was
down
supposed to
this.
ask you earlier in the show why we're talking about health insurance when we're a financial program. But
you just answered your own question.
I did,
because you realize how high stakes this is about
well,
finance.
right, and the whole COLA and Social Security payments being affected, and the cost to retirees, retirement income planning is why we save and invest. So it ties in, right?
Yeah. This is a huge part of people's retirement. I see people with millions of dollars fearful of retirement because of healthcare costs.
Oh, sure.
When I ask people, and I've been doing these shows with retirees and getting their real retirement story, I call it. If you haven't seen those, I'll put the link up here. You can hear their stories. You hear them, they're not worried so much about money anymore. They're worried about their health. So health insurance is really, really important, and
Top
you
of
have
mind.
to integrate it in finances. If you're not integrating it into your financial planning, then you're missing the boat. So
You're making a
but
costly mistake by not planning for it. And the more you plan
right,
ahead for these costs and these inevitabilities that you help your clients do this, and people you work with, the better off you're going to be down the road. You're going to hopefully not make costly mistakes. Now, people are saying, well, what do you mean? When my Medigap policy goes up 25%, that's not a mistake I made. That's nothing I could do anything about.
right.
Well, you can budget for healthcare increases in your plan, and you can know that a lot of people go into retirement thinking they're not going to have to spend that much out of pocket on healthcare because of Medicare. And that's the misconception.
Because it's a set price.
Yeah.
And the Medicare companies, the insurance companies are not allowed to increase your price, Tony, because you used a bunch of health services. They have to do it across the board by region, birth year, zip code. So it's not like you're alone and getting
No.
singled out because you use it.
Right.
Everyone's paying. Even those that never
Yeah.
use it are paying
Yeah.
the price increases.
Yeah.
So you switch. So you got into it thinking this is going to be easy glide path, and now all of a sudden you're getting hit. What do? You got to talk to your financial advisor or your insurance broker. And you got to switch. And I'm going to go through. There's a catch. Not everyone can switch. But if you're dealing with someone helping you with this, they should be reaching out to you saying, "Hey, prices are going up. Do you want to shop around?" If you're not, you might be working with someone that only sells insurance for a company. So they might work for company ABC.
They're
That's
locked
the best
into one of
price
the big name
price.
companies.
Right.
They're
Yes,
a
they're
rep
not gonna
for
say
this company,
right,
and they're
right.
being compensated by this company, and that's who they're locked into. Or they're not necessarily looking out for your best interest. They don't necessarily have to.
Or they just
So
they're not being malicious, they just don't have the tools.
yeah.
The same with like health insurance, car insurance, home insurance. If you are working with someone that works for a company that sells it, of course theirs is the best one until it's not, but they're not going to reach out and tell you. Now,
Right.
if you're working with a broker that's like, I can represent 10 different homeowner insurance companies.
Yeah.
I don't even know if
Yeah,
there's
it's
10 in
like
Florida. But
health insurance, and I'm glad you brought up this point, because it's people treat auto insurance and other types of insurance differently than they look at healthcare insurance. But shopping around, it's like your internet service or your cable bill or your phone, your cell service. If you don't shop around once in a while and put some pressure on them, you have to shop around. My wife and I made a multi-$1,000 mistake, and we're out thousands of extra dollars based on how long we stayed with we kept our homeowners insurance with the original company we bought it with 30 years ago for years, for 20
Yep.
years. And we finally said, our homeowners insurance is outrageous what we're paying. It just seems so high. Let's look around. Dan, I would be embarrassed to tell you, through a reputable company they just raised it every year, and we didn't do anything about it. And we went to another company, and it was literally thousands of dollars a year cheaper.
In going forward too.
Yeah.
So the decision you make now can save you thousands, tens of thousands of dollars over your lifetime.
So shop around once in a while, review it. Yeah.
People get not lazy, just if you don't think about it. No. Until you start getting 20% increases, then you're like, wait, hold on a sec here. What's going on? So what do? You switch, you shop. You don't switch unless you can. Now, a lot of states have rules that you could switch on your birthday. That month, you could switch. They call it a birthday rule. Florida, we don't have that. So if you want to switch your company after you're 65 now, you're not just turning 65, you can get on a plan. They can ask you medical questions. There's underwriting, and each company's got different underwriting rules. Each state's got different underwriting rules. So in Florida, for instance, if you want to switch your Medigap policy mid-year, like June or whatever, you have to go through an underwriting process. It's not like Medicare Advantage and Medicare prescription drug plans that you switch every year during the annual enrollment period. They can't deny you. They don't ask you medical questions. You could switch. Medigap can ask you medical questions if it's not during a special election for you. So you have to be aware of that and make sure that you are capable of getting through that underwriting process before you switch. In other words, don't cancel your existing policy until you know you have the new policy active and confirmed.
Well, sure.
It would be like, switching auto insurance. Oh, I'm going to switch to Geico later because it could save me whatever, caveman. I think I'm getting them all mixed up. All right, I'm going to do that in a couple of weeks. Let me just cancel my policy now. Now you're driving around without insurance.
Oh,
don't
you
do
can't
that.
do that. You can't do that.
And I don't think a lot of people do that for health, but it can get interesting because you got to remember, it's not like Medicare Advantage where you're guaranteed. You have to go through underwriting. So first thing you do is you contact your broker. Say, hey, I'm not happy with this. They should be reaching out to you, but say they don't. Say, hey, I got to check this. My price has gone up to X dollars. Where can I go? Shop around. In Florida, there's a website. I'll put it on here for people watching on YouTube. You can go online and see every Medicare supplement company price for your age and your zip code. That's how it works in Florida, zip code, like you said, Tony. Just do it and say, oh, wait, I can get it from that company. Why wouldn't I? Because sometimes the price is dramatically different. And you might also say, hey, maybe I will go away from a G and go with a high deductible G. Or maybe I'll switch to the plan N because that saves me $60 a month. And yeah, now I have a copay of $20, but I'll take a $20 copay. I'm not going to the doctor 3-4 times a month. I could save some money. So it pays to look around. And remember, yes, go ahead, Tony.
Yeah, you're going to talk about Part B and D, and maybe you're going to get to this too, but a mistake that people make when they're shopping around is, wow, this one's a lot less. I'll just switch to this one. Oh, wait, my doctor that I like to see or my physical therapist. As we get older, a lot of people have regular physical therapy appointments or they have a regular doctor or dentist. You need to make sure that they cover what you need and the doctors. And that's probably the biggest difference between plans other than price. People, if you focus just on price, what we're talking about, you might shoot yourself in the foot because then, so to speak, because your doctors or your local hospital, where you like to go might not be covered by that new plan you're looking at.
But that's the beauty of Medicare and supplements, Medigap. There is no doctor network, whereas Medicare Advantage, you have to care about that.
Oh, I see. That with
That's
Medigap,
why you could shop mid-year. You don't have to worry about doctors because if they take Medicare, they take your supplement. That's the beauty.
As long as they take Medicare. Yeah.
Right. Yeah. But this does not replace your Medicare prescription drug plan. Just don't forget, those are two different things. Some people forget that because they're on the same drug plan they've been on for years too, and they could be saving. Right. So the recommendation I have for people is don't get lethargic about this. Be proactive and start shopping. Shop for other companies. shop for other plan letters, N versus G, high deductible versus no deductible. It's worth looking at this because thousands of dollars. I was just looking in Florida because that's where most of my clients, I have clients everywhere, Tony. I had one, I helped, she turned 65. We signed her up, cheapest plan. This is great. Oh, it's in my budget. Later that year, she got a 17% increase. Boom. It's like, what did you do? I'm like, what did we get? So we switched right away. We cut bait early because why sit there and wait through this price increase just because it's that I don't want to be bothered. Of course, I would also recommend you look at the underwriting questions first before you decide to switch.
Sure.
They're there. You can look. I send them to people, say, hey, can you answer all these questions the right way? Because they tell you, if you answer yes to this, you're out. You don't get it. If you answer no to all these, you're good. I'm not telling people to lie. I'm just saying look ahead before you waste your time.
Yeah, because you might not be able to switch based on
you might not be able to switch
conditions. Yeah.
Right. And then that's when you have the conversation, do I switch to a Medicare Advantage just to save money? And then pros and cons of that. And there's another rabbit hole we can go down. So I recommend you contact somebody and get this done because it doesn't take long at all. Like the commercial says, 10 minutes and you could price it out. How long does it take to look at pricing? It's not that difficult. Now, you got to remember, this pricing is only as good for a year. So the next year, and you don't want to be switching all the time. But you might be locked in due to health reasons. You might be locked in because the price you got is grandfathered in and it's really good. But how do you know that? Unless you shop. That's what I'm telling people to do. So give us a call if you want. We could shop multiple carriers. I have software just right up there. I deal with health insurance, Tony, like you said. Why? I'm a financial planner, but I'm a certified financial planner. So I'm talking about investments, of course, but income. I'm talking about taxes. I'm talking about estate planning, and I'm talking about health insurance because why not? I will gladly get someone on the phone, a health insurance broker with my client. Let's figure this out together. Saves them so much money. Why not? I think it's critical. And so if you're not doing it, do it now. That would be my recommendation.
Yeah, and use the QR code at the top of the screen there in the corner to get a hold of you with any questions, Dan. Our listeners can just do that, and viewers actually can do that. And if you're just listening, you can pick up the phone and give Dan a call. What's your website address? That's probably the easiest thing for people to do.
Yeah, easiest is go to dolphinfinancialgroup.com. Dolphin
All right.
Financial Group.
And thanks for setting me straight. I didn't realize that the Medigap and the supplemental, you didn't have to worry about in-network.
Yeah, that's one of the primary reasons people get it. They don't want to be bothered with
Because
networks.
with Advantage, it's really based on in-network. I mean, it's really limited.
Right. And your doctor could leave mid-year and you're stuck. What are you going to do?
Yeah.
So you don't have to worry about that with supplement, but you have to worry about the price.
Yeah,
because
exactly.
A lot more money. But
yeah,
again, this is why we're talking about it. So Tony, thanks for another good show. We'll catch everyone next week.